Good afternoon. I'm calling to order this meeting of the Health, Environment, and Community Engagement Committee. My name is Cam Gordon. I'm chair of the committee. I'm joined today by Alondra Cano, Andrew Johnson, Lisa Bender, and Jacob Fry. It's a quorum of the committee. We can conduct our business. The agenda today only has 2 items on it. The first is a consent item, and the second is a discussion item and an interesting presentation. I'm going to move the consent item, which is setting the public hearing for August 10th for the abrasive blasting permit ordinance amendments. Any questions on that? All those in favor say aye. Aye. Any opposed? That motion carries. And so then the next item is our lead hazard control presentation. And I think, Lisa, are you going to lead that up, or Mr. Huff? Okay, welcome.
Thank you, Mr. Chair, council members. My name is Daniel Huff. I'm the Director of Environmental Health. We're going to tag team our presentation today. I'm going to just start off with a bit of an overview, talk about what the lead team does, why we do it. We followed up by a deeper dive into how the work is done, and then what we're finding and looking for, how we are reimagining our work to ensure that we're best serving the children and families of Minneapolis. First of all, as you know, lead is a heavy metal. It's a toxin for the body. It is, although it affects a lot of different organs, the most significant effect is on brain development. It's a nerve toxin, and it impacts children disproportionately than it impacts adults. There's 2 reasons for that. One is children, because their bones are growing, they take it up more quickly. They get about a 50% greater absorption of lead than adults do. But also it's at a critical period in their development, especially children that are from 0 age on up to 6 years of age, where their brain is really developing. We have a lot of sources of lead exposure. I've brought a couple samples for you today. This toy, dinosaur. We have a lot of toys that were made either out of lead vinyl or the paint itself being lead paint. And find a lot of old toys and sometimes even new toys that have unacceptable levels of lead in them. We also find products such as a traditional bean pot. And Alex will talk about some of the work that we're doing there, but it's the lead glaze on pottery that will leach lead during the cooking of food. And then the most traditional source is through lead paint. Lead paint was used in this country in residential settings up until it was banned in 1978.
Can I just ask about soil? I know that in some parts of the city, because of traffic and when there was lead used in gasoline, it seems as though the soil has more lead in it than in other parts of the city. Do you see this as a source of it? And I know when I also was doing and working in early childhood education, people were concerned because kids would play in the soil and in the dirt and it would get in their mouths. Do we see that as much of a risk or a source of lead poisoning now?
Mr. Chair, yes, it is still a lead risk, because when we had leaded gasoline that was all in the atmosphere deposited into the soil, it is not the primary source that we see for causing lead poisoning. However, when we do orders to remove all lead hazards, we ensure that there is proper ground cover. So as long as you have vegetation, grass, lawn, whatever, then you're going to be protecting the child from that soil.
Thank you.
We also have a number of consumer products. This top right here, this is makeup that was just recently found on a 2-year-old. The makeup had come from another country and had extremely high levels of lead. It was actually determined to be the source of this lead poisoning for this child. We have imported candies are often also contain lead. So we have a number of consumer products that are usually those that are purchased overseas and brought back to the States that may contain rather high levels of lead. The most common source, however, remains in our housing stock. The majority of our houses were built before 1978, and therefore it is safe to assume that the majority of our housing whether it be rental property or owner-occupied, contains lead paint. And when that lead paint is allowed to deteriorate and is not repainted over with a latex-based paint, when the surfaces are exposed, that lead is absorbed by children either through just having a toy and some lead dust and picking it up. There's a lot of obviously mouth-to-hand behavior for young children. And then we also have actually some families, when they have renovated, doing the right thing of really renovating their home, have actually poisoned children because they have not used lead-safe work practices and exposed lead that may have been intact as they tried to renovate. I do want to introduce our Lead and Healthy Homes team here. We have a few folks in the field, but we have Hannah, Chris, Eliza, Alex, and our manager, Lisa Smestead. Michelle and Fardoz are in the field conducting lead risk assessment right now, and Jen Cheetah is out today, but really a phenomenal team. One of the reasons that we have been successful in Minneapolis is because of the amount of money that we have been able to bring into the city through competitive HUD grants. We have brought in over $17 million in grants since 1997. And by we, I really mean Lisa Smestead. Under her leadership, this team has just been phenomenal. These are federal dollars that have been brought to this city and spent in Minneapolis for the purpose of making our children safe. And as you can see here, we really have a huge success story here. If we look at how many lead poisonings we had 17 years ago, we had almost 1,000 in the city. And we look at where we were last year, phenomenal success that this group has achieved, going from all of these children who were suffering and had lead poisoning. Now this is at 10 micrograms per deciliter, and I'm highlighting that it's at 10. Lisa's going to talk about new CDC guidance that says really the level of concern is at 5 micrograms, and what that means for us as we address that issue. So one of the things I want to do now is I want to turn it over to Alex, who will talk about how we have utilized a grant that we're just wrapping up now, the Safe and Healthy Homes Grant, which is part of that $17 million boon that we have received from HUD. He'll walk you through that and be able to answer any questions specifically about how that program works.
Thank you, Dan. Chair Gordon, council members, thanks for having us today. First and foremost, my name is Alex Vollmer. I am the project coordinator with the Lead and Healthy Homes unit. So as Dan was alluding to, we are in the process actually of wrapping up a grant that we got in 2012 called the Safe and Healthy Homes Grant. Primarily, this is a lead hazard control grant, so a lot of the money goes to that. But really, the grant had three big goals. So the first is to make lead safe 200 dwelling units within the city. Our primary focus on that was properties with a lead poisoned child, or like we call it an elevated blood lead level. The second goal of the grant was to induce additional primary prevention. We wanted to expand our footprint, expand the organizations that we were working with, and really reach out to a lot of different community partners to get to a number of different places. And the third is we actually received a small amount of supplemental healthy homes money. So we wanted to investigate different health and safety hazards inside of houses, and we're able to provide some fixes for those as well. So that was pretty cool. So here's kind of a breakdown of where the money went to. Like I said, the majority of it was for lead hazard control. So we had just over $2 million for that, $2.3 million to do work there. That's inspections, rehabilitations, outreach, blood lead testing, lead safe work practices, trainings, things like that. $180,000 came for that supplemental healthy homes money. We required a 10% match for any contracted work from property owners, so we got a couple $100,000 there. And then the city's general funds and CDBG funding allowed for some matching salary funds too. So, The partners that we were working with, we really wanted to reach out, like I said. We were able to do that, and we had them work in a number of different ways and a number of different capacities. Project for Pride in Living and Urban Homeworks, they do rehabilitations on low-income homeowner properties, so we were really able to leverage our funds and provide deep, exhaustive rehabs on some of these houses. Sustainable Resources, Clear Core USA, another one that's not up here, but Minnesota Visiting Nurses Association. They work with us really closely to do outreach, blood lead testing, general lead education. They're in the community quite a bit. They're talking to a lot of different folks, so they're a really big ally for us. And then Think Small is a licensed in-home daycare advocacy group. So we were trying to reach kids that may not live in the city, but spend a lot of time in the city, particularly in these older houses, as make sure that they're safe as well when they're coming into the city and going to the daycare. So kind of how we work, once a property is in our knowledge base, we go out and do, it's called a lead paint risk assessment. So we use this machine right here. It's called an X-ray fluorescence. If you guys want to touch it later, you certainly can. But what it does is it's a non-destructive instrument. It gives us instant results. We test all surfaces inside and outside of the property. So the non-destructive is cool because we don't have to break anything. And then the instant results is really great because we'll end up taking 400, 500 shots at a different house, and we can give a very exhaustive and comprehensive report basically to anybody right on site. In addition to the XRF gun, we also do dust wipe samples. We are charged, particularly when we're investigating lead-poisoned children, we are charged with trying to determine where that source of exposure came from. So a lot of times it might be from invisible dust that's just breaking down inside the house. So we'll kind of try to figure out where the child spent a lot of their time and take dust wipe samples. And so here on the left is a picture of Hannah using the XRF machine at a recent inspection. And on the right is Jen Cheetah. She's preparing a sample for analysis there. So once this is all done, we'll take all that data back to the office, write a report, write work specifications, figure out our contracts with property owners and contractors. And I'm not going to get into too many details there, but if you guys have any questions for me, I'd be happy to answer them anytime. So once the work actually starts, once the contracts have been written, once the work specifications have been figured out, we want to get rid of the lead. So when we're doing this, it's a federal mandate and federal requirement that the families are moved out of their house for the duration of the work. Typically, this lasts between 1 and 5 days. But one of the reasons why they do this is so they're not being exposed while the work is going on. And the second reason, if you see the slide, is that the contractors are required to put down a bunch of poly sheeting everywhere to ensure that everything is contained. And this is supposed to be industry standard. But what will happen is that one of the things that we do is we have a city-owned duplex located in South Minneapolis on 26th and Bloomington that we offer free of charge to our families while this work is going on. So we work with a community liaison. She helps set up the relocation, the exchanging of keys, getting lock boxes there for contractors, making sure that the property is set up nicely so that way the contractors can get in and out as quickly as possible. She'll make sure they have all their belongings that they need. The house is modestly furnished, but they do still need to bring some things along with. So she'll set up all that kind of stuff, and she is an absolute dream to work with because it's a lot of work. So once the family's relocated, the contractors come in, they put down the sheeting, they make sure that everything is all covered up. Once they're all done, they pull down the sheeting, and then to ensure that no lead hazards have been left behind, inspectors will actually go back out, do a visual inspection, and take another series of dust wipe samples to make sure that any lead dust was cleaned up as well. So this is kind of the final product, really with our money. The bread and butter kind of is doing window replacements. That's always seen as a component that is kind of enemy number one in terms of deteriorating paint, friction surfaces, a lot of opening and closing. You might put a fan in the window, it's just open, a lot of fresh air is coming in, so you get dust that's blowing in. So the pictures that were shown earlier, we're trying to exemplify the same thing. As you can see our windows here, they're nice double pane windows. We remove any lead-based paint or we enclose any lead-based paint. So it's really a permanent fix on the property. So hopefully once we go into a property, we don't have to come back to a property. That's another goal of ours. So like I said, we also got a small amount of supplemental funding for Healthy Homes Hazards. So I'm just going to kind of give a little quick smattering of some of the things that we have seen. Here in this picture, and it's a lot of times, we're public health advocates, and so when we go into houses, we're primarily looking at lead, but it's hard not to notice other things. It's hard for families not to ask us about other things and what can I do about this? What's causing this? Why am I experiencing these things? So when we're looking at things, in a more holistic sense, we can provide a lot more answers for people. So here's a good before and after picture of a bathroom. You have lead-based paint issues, you have mold issues, you have moisture issues, you have a potential route of a place for pests to come inside because there's no screen on the window. So we were able to address this for the family and hopefully make it so that the water intrusion doesn't happen again. Another thing that's a big deal in Minnesota is cold and excessively cold and intrusion in homes. So here's a property that actually had some holes in the wall, so there's water getting into the door jamb. The family actually was not able to close their door all the way. In January, that's kind of a big deal. So we were able to identify these things, and with this extra money, we're able to provide an actual fix for that. So it's a really good thing. Another thing we see is asbestos around piping and vermiculite. So we want to get rid of that. The insulation is not good for people, particularly when it's loose like this. There's some cat refuse here, so we try to clean that up whenever possible. We work with a lot of invisible hazards. We see carbon monoxide detectors are a big thing. People not sure where to put them. Next to gas appliances, they're not there. Outside of bedrooms, they're not there. Another big kind of hot topic issue right now is radon. We do radon inspections at each of our properties so we can find out if that's a hazard that needs to be addressed, and we can provide assistance for that. So it's something that's another really good thing that people don't know about. We talk about it, and then we are able to provide assistance there. Clutter and refuse, you have pest management issues, you have food safety issues, you have hygiene issues, you have trip and fall hazards, there's more mold, more water intrusion issues. So these are the types of things that we're able to do and assist with this money. Trip and fall hazards, this home was actually the woman who was living there, her child is a 2-year-old who has cerebral palsy, and so she was really worried about, he's got a lot of physical therapists coming in, speech therapists, educational people, and she was worried about the status of her front steps. We also have, structural collapse. There's a second floor balcony here that is not being supported by an adequate footing, so we're able to take care of some of those things. In addition to actually going out into houses and going into people's lives, we try to get out into the community and reach people that we may not have been able to do in the past. So a couple times a year, we try to go out to events, primarily in like the South Central and Phillips neighborhoods, the north sides where we do a lot of our work. As Dan was saying, we were finding a lot of this common theme was that we were finding these houses that had lead-poisoned children, but there's no lead because the house was built after 1978, or it had gone through a previous grant, so all the things had been made lead safe, but there's still something going on there. We start digging a little bit deeper, we find out that these bean pods are actually causing a problem. These things leach out. So at these events, we provide product testing, whether it's toys or jewelry, anything that people may have on their persons at the time. And this particular event, we actually offered we kind of promoted it around the bean pots. So we were offering, if they had a lead bean pot that they were using, we would give them a crock pot so they could still cook their beans. A lot of families they don't want to give us they don't want to give up the use of these things because there are a lot of family heirlooms that have been passed down from generation to generation. But it's important that we are able to provide them with at least an alternative so that way they can see the benefit of stopping to use it. So the people that we serve in our programs, while lead is not, it's not predisposed to attack any one individual. We do find that there are some, communities that are being affected more than others. One of the big ones is rental properties. We see a lot of low-income rental housing, a lot of deferred maintenance. So more than 3/4 of our participants in our programs are rental property owners and tenants.
I think we have a question maybe on this slide, Councilmember.
Yes.
Yeah, I just had a brief question on the slide that you showed with the bean pot.
Yeah.
So is the lead mostly on the coating or on the clay, inside the clay that it's made out of?
Chair Gordon, Councilmember Cano. It's actually in a number of different spots. It kind of really depends on the individual bean pot. So sometimes it'll be on the actual glaze itself. Sometimes it'll be like in the decorative paint on the outside. I mean, the biggest concern is on the inside where the things are actually being cooked. This one, you can't really see it, but you can touch it, you can feel that it's been abrased and it's actually been used. So it could be in a number of different spots. So.
I was just trying to identify the source because it's a really traditional Mexican cooking instrument. So.
Yeah. And that's what we were finding was that a lot of people are using these. So I'm going to kind of run through here quickly just to continue with that question. You can see in the bean pot in this picture how the center has been like really, really worn down. So that was actually like in the glaze itself. So, but one of the things that lead was used in paint for was to make colors a little bit brighter and more bold. So you see it in paint as well. So like I was saying, we serve a lot of our clients are rental properties. Again, lead doesn't, it's not judging anybody at all, but, we see, again, over 3/4 of our populations that we work with are minority races. Almost half of them are African American. So, it's a social justice issue. It's an equity issue, as well. So, again, the people that we serve, a lot of low income. Basically, 100% of our clients are under the 80% area median income for the year. More than half of them are actually under 50% area median income. For a family of 4, the 50% is $43,000 annually for a household, and the 30%, which is more than where half of our people are at right now, for a family of 4 is only $26,000. So again, a lot of rental properties, deferred maintenance. They don't really have a lot of access to outlets, so it's really great that we have these programs available to provide some sort of relief for these families. Our grant so far has been very, very, very successful. We're wrapping up right now. We had a goal of 200 units inspected. We had a goal of 200 units made lead safe. As of right now, we did over 250 units inspected. We made lead safe 229 units, so we far and exceeded those goals. We reached over 1,000 different people, whether it's property owners or parents or children. We were able to provide lead safe work practices for over 100 rental property owners and homeowners. So that way, when they're doing work on these houses, they're aware of lead, they know where it is, and they know how to deal with it safely. Through the help of our partners, we were able to provide these extensive lists. It's kind of hard to believe, but this is the exact same kitchen on a before and after. So we were able to give money to deal with the lead-based paint issue. In this case, it was Project for Pride in Living. They were able to take this house and completely, transform it. It was fantastic. Here's another one, very significant water damage issues, a lot of lead issues. This was the outside of the house from that bathroom picture that I showed you earlier. We really went above and beyond this grant, and I'm really excited about it. The inspectors that we have working for us are very careful. They're very cautious. They're very smart. They care a lot about the people that we're serving and we're working with. So we're wrapping it up next month, and it's been just a fantastic success. So that's all I have, and we actually have a new grant starting up, and Lisa's going to talk about that right now. So I'll hand it over to her. So thank you very much.
Thank you very much.
Chair Gordon, council members, At what level is a child poisoned? Well, there is no safe level of lead exposure. The state law mandates that we inspect at 15 micrograms per deciliter of blood, but in 2008, the health department implemented best practices and started enforcing at 10 micrograms per deciliter, which was allowed under state law. In 2012, after years of looking at the science, the Center for Disease Control revised the guidelines down to 5 micrograms per deciliter. The health department could not inspect under the lead poisoning rules because the state law was still 10 micrograms per deciliter. So we worked with the state health department and other local health departments and got the law changed in 2014 to line up with the CDC's recommendations. In 2015, with the legal barriers removed, we were able to offer equal service to all lead-poisoned children. So this is a graph of our lead inspection response. We pushed really hard to get the rules changed because all the children in orange on this graph represented were not being served. The lead hazards remain in their homes to poison siblings and future tenants. This represents about 3,000 children since 2005. Halfway through 2008, we started enforcing at 10, and you can see that 5 years later, in 2011, the number of children in blue, which were being poisoned at that higher level, is smaller. When we inspect at a lower blood lead level, it prevents the blood lead levels from getting higher. This is a different way to visualize the children that were not served. Each of these dots represents a child that was orange in the previous graph, with a blood lead between 5 and 9.9 micrograms per deciliter. July isn't over. If we had July on this graph, you would see that we have 78 cases so far. We still have one more week to go. So this is 5 times the caseload we were working at last year. Because of the grant and the resources the city gave us, which was an additional inspector one time in 2015, we are able to keep up with the demand for inspections. These properties are getting inspected within 10 days of our receiving a report from the State Health Department and are being offered an emergency lead swab, which is a specialized cleaning for lead dust with some touch of painting to reduce immediate lead dust exposure in the homes. So we now have in 2014, we applied for and received the Health Improvement Partnership HUD grant. This grant is for $3.4 million, and we're pledged to make 280 dwelling units lead safe and to correct other housing-based health hazards we find there. The homes of lead-poisoned children are our first priority, and our next priority is to stop using children as lead detectors. The system is set up so that we only respond after a child is poisoned. We know the age of the housing, we know the location of most of the housing, and we are trying to work towards a more proactive model instead of a reactive model. This is a block map of the city, and the orange you see overlaid are census tracts that show lead poisoning. So everywhere you see orange, at least 5 children in that census tract have been lead poisoned. The darker the color, the more different time categories where children were poisoned there. The takeaway from this map is that no neighborhood in Minneapolis is free from the impacts of lead poisoning. We zoom in a little closer here, and on the left you see a neighborhood view, and this is from Central Neighborhood. And you can see that almost every block has multiple lead poisonings on it. If you look even closer on the right, and this is not even the worst block in the city of Minneapolis, every red dot represents a poisoned child. The green shading on 5 of these properties represents homes that were made lead safe with the HUD lead grant that was run either by Minneapolis Health Department or Hennepin County HUD grant. All the red dots represent properties where we know there were lead hazards, but we don't know if they still exist. The lead could very well be there waiting to poison the next child that moves into these properties. As resources allow, we are going to start targeting individual blocks where we know there's a history of lead poisoning to make every house on that block lead safe. These are our children, our friends' children, our neighbors' children, and the children in our schools. Most of the children in the graphs I've shown you today are currently in the K through 12 school system. All these children can be more prone to violence, unintended pregnancy, learning disabilities, and as they grow into adulthood, they will have an increased risk of heart attack, kidney disease, and high blood pressure. In every country in the world, when lead was taken out of gasoline and out of the air we all breathe, 20 years later, there was a payback in society in crime reduction. We need to get the lead hazards out of our homes for the health of our city and for the health of our city's children. Thank you for giving me the opportunity to come before you today and talk about what we have achieved and the challenges we face before us. Any questions?
So I have a couple questions. Maybe you could go back to the last map. And are the red dots historic, or are those current children that we know are living in the homes now? I'm curious about how to interpret this.
Those are historic. Those are within the last 15 years.
Okay.
So some of the children might still be there, some might not. There's a lot of rental.
But it would definitely be a good marker for where the house might carry the contamination. And so our hope would be to go to those houses or go to all the houses on the block.
I would like to go to every house on, Chair Gordon, I would like to go to every house on that block, because just because there isn't a red dot next door on one of the blank spots doesn't mean there aren't lead hazards there.
Mm-hmm. And do we have to get permission from the property owner, I would assume, to go in and do a test?
Yes, we do. Well, not if I'm sorry, Chair Gordon, if the child is lead poisoned, we do not have to have permission. The parents give us permission. In 1 or 2 cases, we've had to get a court-ordered search warrant.
But that's right. So, but in this case, we don't know if any of these, I mean, presumably maybe a couple of them have children who have been tested and so we can get in. But the idea for this preventative, proactive approach would be offering this opportunity to all of the houses and asking if we could come in and test.
Chair Gordon, that's correct.
And then I'm curious about the 3.4 million grant that did we get that last year?
It was awarded in the 2014 application, so we actually got the money in December of 2014, and then it takes us about 3 to 4 months to get all the paperwork done and set up so we can start spending money, but we are doing production under that grant now.
Okay. And how long do we expect that grant to go for, or the funds to last for?
Chair Gordon, those grants are 3-year grants.
And I'm also concerned that we maybe have I don't know what the right word is, but built up our staff based on past grants. And do we have the funding now to maintain this level of staffing to do these kind of inspections and to run this program? Or are we concerned about that?
I think Dan would like to answer that question.
Okay, thank you.
Chair Gordon, obviously the grants allow us to hire additional lead risk assessors more so than what we receive in general fund or CDBG. We currently have a 1-year appropriation for a lead risk assessor from the general fund. That has allowed us to meet this unanticipated demand for our services. Once we drop to 5 and those levels have quadrupled or even more, it's that additional resource that we have been able to achieve that. The goal is that if we can get ahead of those 5s, then we can begin to reduce anything else. By really being much more proactive. Now, we'll have to see what happens next year because it is just a one-time funded position to see if with our grant resources we're able to maintain that inspection load.
Okay, thank you. I think there's some other questions too. Councilmember Connell?
Thank you. Could you talk a little bit about your outreach mechanism? How do you let people know about the program? How do people find out about the program and the multilingual component? So how do we engage Spanish speakers, Somali speakers?
Chair Gordon, Councilmember Cano. We contract with ClearCorps and Sustainable Resource Centers, and they both have multilingual staff. And they do outreach and enrollment into our grant programs. We also have a Spanish speaker on staff, Belvina Jones. She handles most of the relocation for our houses. And we have a staff member who's in the field right now, Fardoza Omar, and she speaks Somali. Several of our staff members have a smattering of Spanish, but we also bring Belvina out to interpret for us on all our inspections. For general outreach, we go to language fairs. We employ Belvina and Fardoza at general health fair and other events like that.
Wonderful. Thank you. I just want to commend all of you. This is really amazing work, and I know that it has an impact on our communities of color, particularly, Ward 9 residents. I can see the map, that deep orange, which happens to be my campaign color as well. So, but thank you for your hard work. I really appreciate it.
Thank you.
Thank you, Mr. Chair. I just want to say thank you as well to you and your team for all this incredible work that you're doing, which is very meaningful and obviously is helping a lot of people in our city. And then I also just want to recognize as well the role for retailers and corporations to play in all this. Previously, I worked at Target Corporate. I had friends on the global product safety and compliance team. They'd actually go out and do these inspections of production facilities overseas. They go to China and check out the manufacturers who are making children's toys. And they would say they'd go in and they would see a big vat of lead paint marked for U.S. toys, and then one marked for, Asian countries, and it would have lead in it ultimately. So you'd see the paint that's lead-free for the toys destined for America, and the toys that are destined for other children in other parts of the world with lead in it. And I think that that's something that we have a much bigger fight on our hands, a much bigger problem on our hands that's really global, where it's still happening, it's still being used. Blew my mind, Dan, when you said that candy is being found with lead in it. I mean, just completely unacceptable, so horrible. And there's a huge role for retailers to play in putting pressure on these manufacturers, in holding them to tough standards, and even saying, not only do we expect that our toys coming into the United States don't have any lead on it, but you know what? We're not going to do business with you if you use lead on toys, period. And if we start to see retailers really step up and take it to that next level, I think we can have a much larger impact on that global picture and for children everywhere.
Well, thank you very much. Councilmember Fry.
Thank you, Mr. Chair. Just to reiterate, thank you for all the work you're doing. And I think many of my colleagues as well as staff probably know that we have an ordinance that's moving forward. It's an amendment to our existing code that would reinforce with landlords that we aren't able to, if they aren't undergoing significant abatement after receiving a notice that they have lead contamination in their building the first time, then it makes it a lot easier to strip a license away. So thank you for your work.
Well, thank you very much. I appreciate the report and all the great work, and I'm looking forward to when you come back in with a new picture about lead-safe blocks and we don't have any orange or red dots.
Thank you, Mr. Chair. Thank you, council members.
And I'll move to receive and file that report. All those in favor say aye. Aye. Any opposed? Seeing none, then I will adjourn, but I'll stick around to see you can demonstrate how that detector works on the dinosaur for me after the meeting. All right. This meeting is adjourned.